pathologies like sarcoidosis. Granulomatous formation, granulomatous inflammation. So first of all, every student must know about the granuloma. So because directly starting this topic, you guys have to first understand the basic definition of granuloma. So first of all, the first point that is granulomatous inflammation. It is a subtype of chronic inflammation. Like in the acute inflammation, you usually will not get this granuloma. It is a subtype of chronic inflammation. That point is very important. Then after that, they can ask a question from you like how to characterize, how to, you can say, recognize or characterize the granuloma. Like what are the cells that are going to make granuloma? So basically, granuloma is made up of different things. First one is the epithelioid histiocyte. What are epithelioid histiocyte? Basically, these are the macrophages with abundant pink cytoplasm. Those are called epithelioid histiocyte. Then after that, these epithelioid histiocytes are surrounded by joint cell. Let's suppose take in the center we have epithelioid histiocyte, and on the side of epithelioid histiocyte we have the joint cell. We have the joint cell. Then after these histiocytes are surrounded by joint cell, and on the side of these joint cell we have also the lymphocytes. So basically this is the structure of granuloma. Granuloma, you can say the three important things are going to involve in the granuloma. First one, epithelioid histiocyte. Second one is the joint cell. Then third one are the lymphocyte. So please keep this thing in mind. Then after that, you guys have to remember the granuloma is divided into two main types. One is the you can say one is the caseating granuloma, and second one is the non-caseating granuloma. So these are very important point. So let's take a quick review from the first state. Then after that, the important things we will also discuss in the last. First of all, granulomatous inflammation. It is a pattern of chronic inflammation. It is a subtype of chronic inflammation, and it can be induced by persistent T cell response to certain infection like TB, like you have immune mediated disease, foreign body. So what is the meaning of these lines? So first of all, you guys have to remember it is a subtype of chronic inflammation, and if in your body chronic inflammation is going to persist for many months, year, then these infections will lead to the formation of granuloma. Like if you have the tuberculosis infection, if you have immune mediated disease, like you have many autoimmune diseases which can lead to formation of granuloma. Then if in your body you have foreign body, the foreign body can cause chronic inflammation that can lead to granuloma. Then he say granuloma wall of a resistant stimulus without completely eradicating or degrading it. What is the you can say meaning of this line? So let's suppose this is the bacteria, and around the bacteria you are, because bacteria is going to produce infection or inflammation. So after when the inflammation is going to start, this bacteria is surrounded by wall of by granuloma, and this granuloma will not like eradicate or degrade the bacteria. It only cover it, and it only cover it. Why? Because it try to it try to inhibit the bacterial invasion. It will not allow the bacteria to invade. So this is the basic you can say function of granuloma. Then after that, it is the persistent inflammation that usually lead to the formation of granuloma, and if the inflammation is persistent, that will lead to fibrosis and organ damage. So here they only mention the important points. First of all, you guys have to remember granuloma is a subtype of chronic inflammation. Then what is granuloma? Basically it is a, you can say, the composition of three things: epithelioid histiocyte, on the side of that we have joint cell, on the side of that we have lymphocyte. So these are the three things which will make the granuloma. Then after that, you guys have to remember how the granuloma is going to form. So basically we will study the mechanism of granuloma, but just remember one thing: granuloma basically it is a persistent, you can say it is a result of persistent infection. Like in your body, if you have TB, if you have autoimmune disease, if you have foreign body, these are the things which will lead to you can say persistent inflammation, and after the persistent inflammation you will get chronic inflammation, and that will lead to the formation of granuloma. Then granuloma basically you can say surround the bacteria. It will not allow the bacteria to invade, it will not allow the bacteria to spread. So basically this is the main, you can say, the function of granuloma. Then after that, if we study the histology of granuloma, basically we have to remember it is a focus epithelioid cell. Like what are epithelioid cell? These are the activated macrophages with abundant pink cytoplasm, and these are the epithelioid histiocyte or epithelioid cell which are surrounded by lymphocyte and multinucleated joint cell. And they can ask from you in exam, what are joint cell? So basically when a lot of activated macrophages are going to combine with each other, it will lead to the formation of joint cell. So please keep this in mind. So again, let's take a quick review. In the center you have epithelioid cells are epithelioid histiocyte. On the side of that you have lymphocyte. On the side of that you also have the joint cell. So basically through which the joint cell form, when the macrophage are activated macrophages are going to combine with each other. When the activated macrophages are combined with each other, that will lead to the formation of joint cell. Then after that, we have divided the granuloma into two main types according to histology. One is caseating and other is non-caseating. So caseating means there is a central necrosis, and it is usually seen in the infections of TB and fungal. And non-caseating means there is no central necrosis, and it is usually seen in non-infectious etiologies like sarcoidosis. We have the Crohn disease. So these are the, you can say, the important mechanisms through which the non-caseating granuloma is going to be formed in your body. So, okay, so now let's discuss how the granuloma is going to be formed in your body. So here we are going to discuss the mechanism of granuloma formation, or you can simply say what are the steps that are going to be involved in granuloma formation. So first of all, you guys have to remember the antigen presenting cells which are present in our body. They are going to present antigens to CD4 T helper cell, and when the antigen presenting cell are going to present the antigen to CD4 positive T helper cell, these cells will secrete the interleukin 12, and this interleukin 12 will go and stimulate the CD4 positive T helper cell into T helper 1 cell. So let's take a quick review. First of all, these are the antigen presenting cell. Antigen presenting cells are going to present the antigen to CD4 plus T helper cell. So when the antigen presenting cell present the antigen to CD4 plus T helper cell, this CD4 T helper cell is going to produce interleukin 12, and this interleukin 12 will go back and stimulate the CD4 T helper 1 cell to form the, you can say, T helper 1 cell. And when this T helper 1 cell will form, it will secrete the interferon, or you can say gamma interferon, and this gamma interferon will go and lead to the macrophages activation. And when the macrophage are activated, they will secrete the cytokine like tumor necrotic factor, and this tumor necrotic factor will go and lead to the formation of epithelioid macrophages and joint cell. So please keep this in mind. So let's take a quick review again. First of all, you guys have to understand the first cells which are going to participate. These are antigen presenting cell. Antigen presenting cell will take the antigen and present to CD4 plus T helper cell. When the antigen presenting cell present the antigen to CD4 plus T helper cell, these CD4 plus T helper cell are going to secrete interleukin 12. This interleukin 12 will go back and stimulate this CD4 plus T helper cell into T helper 1 cell. when this T helper 1 cell will produce, it will produce the gamma interferon, and this gamma interferon will go and activate the macrophage, and when the macrophage are activated, they will produce the cytokine like tumor necrotic factor, and this tumor necrotic factor will go and activate the macrophages, and they convert the macrophage into epithelioid and joint cell. Then after that they have mentioned here anti-tumor necrotic factor therapy can cause sequestering granuloma to break down and it lead to disseminated disease. So let's take a clear concept from this example. As I already told you guys, tumor necrotic factor is very important for granuloma formation, because when the tumor necrotic factor is produced, it will go and convert the macrophages into joint cell, into epithelioid cell. So let's suppose if you give a drug which is going to inhibit this tumor necrotic factor. So when this drug will go in your body, it will inhibit the tumor necrotic factor. Then if the tumor necrotic factor is not formed in your body, the granuloma is not going to form, because granuloma is made up of epithelioid cell, joint cell, and if you give the anti tumor necrotic factor drug, this drug will go and sequester the granuloma to break down. The granuloma is not going to form. Then after that, if the granuloma is not going to form, the bacteria has good chance to proliferate. The bacteria will cause the disseminated disease. So that's why they always mention one thing. Whenever you are going to start anti-tumor necrotic factor drug, you have to first check the patient for latent TB, because in the latent TB, granuloma is you can say preventing the bacteria to spread. So if you give the anti-tumor necrotic factor drug, the latent TB will convert into the active TB, you can say. Then after that, they mention here like when you get the granuloma, the granuloma is associated with the hypercalcemia. This is very important MCQs. How the granuloma is associated with hypercalcemia? Basically, when you get a granuloma, in case of granuloma, there is a one enzyme which is called alpha-1 hydroxylase. This is the enzyme which is present in the macrophages. And you know, if the granuloma is going to form, there are a lot of macrophages, and if there are a lot of macrophages, you have alpha-1 hydroxylase activity more. So if the alpha-1 hydroxylase activity is more, that will lead to the activation of vitamin D, and if you have more vitamin D, it will lead to the more calcium absorption, it will lead to hypercalcemia. So this is the very important MCQs for your exam. Now let's take a quick review of this diagram. So first of all, this is the antigen presenting cell. What is the function of antigen presenting cell? Basically, it is going to take the antigen and going to present to other cell. That's why it is called antigen presenting cell. So here is the antigen. This antigen is going to be taken by the antigen presenting cell. After the antigen presenting cell pick this antigen, it will go to the, you can say, CD4 T helper cell. So this is the CD4 T helper cell. So when the antigen presenting cell is combined with the, you can say, the T cell, it will secrete the interleukin 12, and this interleukin 12 is going to, you can say, induce the CD4 T helper cell into T helper 1. So please keep this in mind. When the antigen presenting cell will combine with T cell, the antigen presenting cell is going to secrete the interleukin 12. I think in previous I mentioned interleukin 12 is going to produce from T helper cell. So please correct it. The interleukin 12 is going to produce from antigen presenting cell. This interleukin 12 will go and stimulate the CD4 T helper cell into T helper 1 cell. So this is the T helper 1 cell, and this T helper 1 cell will secrete the gamma interferon. This gamma interferon will go and activate the macrophages. When the macrophages are activated, they will secrete the tumor necrotic factor, and when you have more tumor necrotic factor, your macrophages will become activated, and when your macrophages will become activated, you will get a granuloma. So this is very important. Let's take a quick review again, because I know I am repeating these things, but these are very important for your exam. A lot of students get question from this topic wrong, because they don't understand the formation mechanism of granuloma. So let's take another quick review to understand this topic of granuloma. So let's suppose I am going to again explain with the diagram. First of all, you have antigen presenting cell. This is the antigen presenting cell, which is going to take the antigen and presenting to other cell. And when the antigen presenting cell take the antigen, they present this antigen to CD4 T helper cell. So this is the CD4 T helper cell. And when the antigen presenting cell will bind with T cell, the antigen presenting cell, will secrete the interleukin 12. This interleukin 12 will go and convert the CD4 helper T cell into T helper 1 cell, and this T helper 1 cell will again form gamma interferon. This gamma interferon will go and activate the macrophage. When the macrophage are activated, they will secrete the tumor necrotic factor, and when the tumor necrotic factor will form, it will lead to the formation of granuloma. So this is very important point. Then after that, we have here the examples of infectious and non-infectious causes of granuloma formation. So first of all, we have the infectious causes, like if you have the infection of Mycobacterium tuberculosis or Mycobacterium leprosy, you will get the granuloma. Then after that, if you have the Bartonella Huxley, which causes the cat's cry disease, it lead to formation of stellate necrotizing granuloma. Then after that, if you have Listeria monocytogenes infection, that lead to granulomatosis infant septica. Basically, this is also the infection which is going to be caused by Listeria monocytogenes. Then after that, if you have Treponema pallidum, secondary syphilis. So basically, all these are the infectious causes of granuloma formation. So these are the bacterial causes. Then we have fungal causes, like if you have the histoplasmosis infection, which causes the endemic mycosis. Mycosis, basically it is a fungal infection. If you have cystomyosis, it is a parasitic infection. So these are the important points you guys have to remember. These are the infectious causes: bacterial, fungal, parasitic. Then you guys have to remember catalase positive organisms in granulomatous can cause granulomatous chronic diseases, like chronic granulomatous disease. So this is very important point. Catalase positive organisms in chronic granulomatous diseases, they are going to form the granuloma. Then after that, we have the non-infectious causes. So basically, in the non-infectious causes, we have the three main categories. One is the immune mediated, second one is the vessel inflammation, that is called blood vessel vasculitis. Then after that, we have foreign bodies. So in the immune mediated, we have sarcoidosis, and we have Crohn's disease, we have primary biliary cholangitis, we have D. Carvan granulomatous thyroiditis. Basically, it is the, you can say, condition in which you will get the hypothyroidism. It is a type of, it causes the hypothyroidism. Then after that, we have vasculitis. Basically, vasculitis meaning inflammation of vessel. So in granulomatosis with polyangiitis, eosinophilic granulomatosis with polyangiitis, giant cell temporal arteritis, Takayasu arteritis, in all these conditions, your blood vessel is going to be inflamed. And when your blood vessel is going to be inflamed, you will get the granuloma, and that granuloma is usually because of vasculitis. Then after that, we have foreign bodies. In the foreign body, you can take the example of berylliosis, you can take the example of talcosis, you can take the example of hypersensitivity pneumonitis. So these are the important examples in which you get the granuloma by non-infectious cause. So this is the topic of granuloma formation. So let's take a quick review of again of this topic. What is granuloma? Granuloma is characterized by the, you can say, collection of epithelioid histiocyte. It is characterized by the joint cell. It is characterized by the lymphocyte. So these are the three things which will make the granuloma. Then again, it is a type of chronic inflammation. Then it is divided into two main types, caseating and non-caseating. So basically, non-caseating has no central necrosis, and the causes include, you can say, like the immune mediated, vasculitis, and foreign bodies. Then we have caseating. In the caseating, we have the central necrosis, and in the central necrosis, we have the different causes like bacterial causes, fungal causes, parasitic causes, and catalase positive organisms. So these are the, you can say, examples of caseating granulomatosis, caseating granuloma. Then after that, you guys have to remember, very important, what are the steps that are going to involve in granuloma formation, because in the exam they are going to ask these steps. You guys have to remember these steps. So this is about the granuloma formation. So let's continue the next topic, that is scar formation. So first of all, you guys have to remember the basic things, how the scar is going to form. As I already mentioned, there are some kind of you can say mechanisms in which your body cannot undergo, when your body cannot undergo regeneration. So when your body is not undergo a regeneration, you will get the repair, and in the repair your body is going to form the scar. But before starting this you can say mechanism, we have to understand in the wound healing we have two main you can say terms. One is primary intention, and second is secondary intention. We have to first understand this term. Primary intention mean the wound edges are brought together that you can say with the help of suture, that will lead to minimal scar formation. So in the primary wound healing there is no scar formation, but in the secondary you can say intention, the edges are not approximated, the edges are not you can say come close together with the help of suture. You will leave themselves, they will try to you can say come close together with the help of myofibroblast. The myofibroblast will come and contract the wound, that will lead to scar. So if they ask a question from you, the scar formation is going to occur in which intention, primary or secondary? So it is the secondary. Why? Because in this the myofibroblast are going to contract the wound, and when the wound is contracted, that will lead to the scar formation. Then another important point is you guys have to remember what are the important causes of delayed wound healing. They can ask from you in exam, what are the causes of delayed wound healing? So if in your body you have infection, so what kind of bacteria that is the most common cause? Like Staph aureus is the most common cause. Then if you have vitamin C deficiency, like vitamin C deficiency, if you have copper deficiency, if you have zinc deficiency. So all these are the causes which can lead to delayed wound healing. And as I already mentioned, vitamin C is important cofactor in hydroxylation of proline and lysine pro-collagen. So that's why you guys have to remember, if you want to cross-link the collagen, you need the hydroxylation which is done by the vitamin C. If no vitamin C, no cross-linking, your collagen is not strong. Then after that, I already mentioned the copper. Copper is very important for wound healing. Why? Because copper is a cofactor for lysyl oxidase. Lysyl oxidase is an enzyme which will cross-link the lysine and hydrolysine to form the stable collagen. So that's why if you not have a copper, your lysyl oxidase will not work and your stable collagen will not form. Then after that, zinc, I already explained this. Zinc is a cofactor for collagenase. What is collagen? It is an enzyme which is going to replace the type 3 collagen with type 1 collagen. So this is about the you can say about the zinc. So these are the important points which you guys have to remember. There are also many other causes which can cause the delayed wound healing, like diabetes, then you have the malnutrition, ischemia, foreign bodies. There are many different causes. So before starting the scar formation, you guys have to remember what is the primary intention, what is the secondary intention, and what are the causes of delayed wound healing. Then after that let's talk the scar formation. So basically scar formation occur when repair cannot be accomplished by cell regeneration alone. It's mean when cell is not going to regenerate, then if cell is not able to regenerate, it will undergo repair, and when it will undergo repair, there is a formation of scar. You guys have to remember. Then they mention non-regenerated cells secondary to severe acute or chronic injury are replaced by connective tissue. It's mean those cells which don't have ability to regenerate, they are going to replace with connective tissue. Then after that, 70 to 80% of the tensile strength are regained at 3 months. This is very important MCQs. Approximately how many months you are going to get the tensile strength? Approximately at 3 months. A little tissue strength regain thereafter. Excess tumor growth factor beta is associated with aberrant scarring such as hypertrophic and Keloid scar. So basically, as I already mentioned, tumor growth factor beta is going to repair, is going to participate in wound healing. So if in your body there is excess amount of tumor growth factor beta, that will lead to the hypertrophic scar and Keloid scar. So let's discuss what is hypertrophic scar and what is Keloid scar. Basically, hypertrophic scar, it is a condition in which there is excessive production of scar tissue that is localized to the wound edges. So basically, hypertrophic scar is what? It is the excessive proliferation of tissue that is localized to the wound. And here they mention in the hypertrophic scar there is a type 3 collagen is more, the collagen that is going to you can say organize in the parallel fashion. Then the collagen that is excessive, that is confined to the borders of original wound. You can see this is the original wound, and the excess collagen tissue is confined with the original border. You guys have to remember. Then it is you can say the recurrence is more common, the predisposition is not you can say more common. Then we have Keloid scar. In the Keloid scar we have the type 1 collagen and type 3 collagen more, and it is going to be disorganized. Then after that, you guys have to remember it can extend beyond the border of original wound with the claw-like projection, typically on the earlobes, face, upper and extremities. You can see this is extending beyond its borders. So you can see this one. So this is not going to happen in hypertrophic scar. In the hypertrophic scar, excess tissue is confined to the borders, and it is, you can say, the recurrence is not frequent. The recurrence is not frequent, and it is going to happen in darker skin people. You guys have to remember this thing. So these are the important points which you guys have to remember. So let's take a again quick review. First of all, hypertrophic scar, it is the excessive production of scar tissue that is localized to the wound healing, wound edges, sorry. Then after that we have the keloid scar. Keloid, basically it is the excess production of scar tissue that is the out of proportion, to the wound. Then after that, if they ask question from you, how to characterize the keloid scar, basically it is characterized by excess type 3 collagen, and in this it is more common in African American people. Then also please keep in mind it affect the earlobe, it affect the face, upper extremities. So these are the, you can say, the important points which you guys have to remember. So basically this second chapter of journal pathology, and in the next class we are going to start the third chapter of journal pathology, that is the principles of neoplasia. So before starting the you can say the next chapter, I will like to share important MCQs with you guys, which are more commonly tested in your exams. So first of all, they will ask more questions from you in the wound healing phases, like what are the vitamins that are required. So please try to remember the name of vitamins. Then after that, you guys have to remember the difference of tissues like permanent, labile and stable tissues. Then after that, you guys have to remember the steps of wound healing, like phases of wound healing. So these are also very important. And after that, you guys have to remember the, you can say, the granuloma formation, like what are the types of granuloma, and you can say in which you can say you will get the caseating granuloma, and in which you will get the non-caseating. So these are the important points which you guys have to remember. And also in the end of this video, I would like to share how you guys solve the U-word question. So just 5 to, you can say, 5 to 10 minutes, because this is going to be very important for you guys, because a lot of the students are currently solving the U-word MCQs question, but they don't know the mechanism, they don't know the strategy by which they should try to solve the question. So let's take an example. This is the first paragraph of your question. A lot of information is giving this paragraph, and they mention below this paragraph you have A, B, C, D option. So whenever you are reading the question, try to pick the important things. First of all, try to understand what the question is telling you. Second, pick the background information, history, allergic history, family history. Then third thing, ask from yourself what the question is telling me, what the question is asking from me. So first thing, what the question is telling you. Second, the basic background history, and the third thing, what the question is asking from me. So these are the important things which you guys have to remember. Then after that, try to, you can say, solve the options one by one by using the elimination method. So these are the important points which you guys have to remember for your exam. So please try to read the question carefully, try to find these things when you are reading question, and after you can say reading the question, try to go through options by elimination method. Like, don't randomly pick any option, try to go with elimination method. So this is the ending of second chapter. Thank you so much.